There are big shifts in nursing happening these days. A new study reveals the ongoing challenges, but also opportunities to better support nurses on the job. Brendan Martin is with the National Council of State Boards of Nursing, and he's here with us this morning to kind of walk us through these new findings. So welcome, Brendan. Thank you so much for spending some time. We all had to figure out the pandemic and find a way through it. It hit nurses particularly hard, though, in that workforce. What issues still remain, and how has it changed the situation for nursing?
Good morning, and thank you for having me, Jeff. Overall, we saw evidence of a workforce recovery coming out of the emergency phase of the COVID-19 pandemic. And our analysis really pinpointed that it was largely driven by a rebound among older, more experienced nurses re-entering the workforce since 2022. However, that said, we continue to see many of the factors driving nurses' intent to leave from the profession. So short staffing, high workloads, acute levels of burnout and stress really persist in the 2024 survey cycle.
Yeah, we certainly remember they were on the front lines during the COVID pandemic, forced many of them, as you said, to leave the workforce since 2022. Give us a sense how many have left and really how many intend to leave within the next short period of time, 5 years or so.
Yeah, so looking back, we saw about 138,000 nurses depart the workforce since 2022. And projecting forward, we found in our survey that about 40% of respondents indicated an intent to leave or retire from nursing by 2029. A little over half of that proportion was due to planned retirement. And so it does give us a little bit of pause, those kind of dual trends that we saw in the data, that older, more experienced nurses, yes, they did re-enter the workforce since the height of the pandemic, but they also report elevated plans to retire in the short to intermediate term. So when we think about sustainable workforce planning, the verdict is not out yet as to whether or not we're out of the woods.
Yeah, it sounds like that. It makes sense. I mean, if you can predict when the retirements are coming, that's one thing you can prepare for. What are some of the other key factors, though, that are driving some of your workforce challenges? I mean, burnout is one of the obvious, stress is a couple of the obvious ones, right?
Yeah, so, the silver lining of the report is that many of those factors have moderated from what we observed in 2022. However, they remain elevated. So to provide a little bit of more context, about 25 to 35% of the respondents in our survey indicated that high workloads and short staffing were driving their decisions to leave the profession. Layered on top of that, of course, are those acute levels of burnout and stress. As many as 2 of 5 nurses who responded to our survey indicated that those sentiments remain elevated. So when we're talking about policy, we really need to be intentional to address those practice context-based factors to make sure that we get into a position where we have sustainable workforce planning.
Well, which really brings up that question, are nurses getting the help they need? What's being done to address this nursing crisis? Are we listening? What does the research say about that?
Yeah, so we have seen in the literature that employers have done a good job of implementing, various mental health services, kind of employee support services. And I think that has contributed to some of the moderation that we have seen in emotional exhaustion, fatigue, burnout, et cetera. But I think 2025 and beyond really represents a critical inflection point where we need to start building on that momentum. And I think that's going to require an all-hands-on-deck type of approach from leaders across various sectors. So our lens is nursing regulation, but it also requires practice, education, policymakers, all coming together to, as you say, listen to the collective voices of nurses and what they're telling us is important, and really put in place policy to address that moving forward.
Real quickly, Brendan, because I want folks to know, is there a place they can go, an easy place to go to learn more about this?
Yes, I would encourage your viewers to navigate to ncsbn.org/workforce. The high-level results are there and links to the full report.
All right. Brendan Martin, thank you so much for sharing your time and insight into this cause. Nurses are frontline workers. We need them, so thank you.
Thank you so much.
Michelle?
Yeah, and Jeff, the nursing shortage is having an impact here in the Triangle as well. Local healthcare systems, we've heard, tell us staffing has improved since the COVID pandemic, but meeting demand is a challenge. UNC Health tells us there are hundreds of open nursing positions across their healthcare system. And to fill those vacancies, they work closely with nursing programs to recruit strong candidates and recruit from elsewhere by offering competitive pay and benefits. Duke Health sent us a statement saying, "We have dramatically reduced our nursing vacancies vacancy rate to levels that reach pre-COVID lows. We've achieved this by engaging our workforce through innovation, empowerment, and problem solving. We did reach out to Wake Med to learn how the nursing workforce crisis is impacting them. We have not heard back yet.